Namaste. In this video, we will understand the parts of the nasal septum. The posterior part of the nasal septum, as you can see, is bony, and the anterior part is cartilaginous. Majority of the septum is known as the septum proper. The anteriormost part is the columellar septum. The membranous septum is the part between septum proper and columellar septum. The membranous septum consists of fibrofatty tissue and skin. It is devoid of cartilaginous and bony structures. Let's look at each one of them. The septum proper has bony parts and cartilaginous parts. The cartilage in the septum proper is this. This cartilage is known as the quadrilateral cartilage. It is because of the shape of this cartilage. Let me orient you. This is the anterior side, this is the posterior side, this is the superior side, and this is the inferior side. So the quadrilateral cartilage forms the lower two-thirds of the cartilaginous part of the nose. It is the antero-inferior part. This quadrilateral cartilage is important because any damage to this cartilage is going to cause saddling of the nose. Next, we move on to the bony parts. This is the frontal bone. This is the nasal bone. We have seen the frontal and the nasal bones taking apart into forming the structure of the external nose also. This big bone here is the perpendicular plate of the ethmoid bone. Below it, we have the vomer bone. This is the sphenoid sinus. Therefore, this bone here is the rostrum of sphenoid bone. Imagine the face that this septum belongs to. Then you can imagine that here will be the teeth, which are embedded in the maxilla, and behind it will be the palate. So this here is the palatine process of maxilla. And behind it, here, it is going to be the horizontal plate of palatine bone. These are the bony and the cartilaginous structures of septum proper. Next, we will look at the columellar septum. When we see the front view of the columellar septum, we can see it like this from the outside, and this part forms the septum. Similarly, when we remove the skin, we will see this part. Here we see two cartilages. The greater alar cartilage and the lesser alar cartilage. The greater alar cartilages has two crura. This is the lateral side and this is the medial side. This is the lateral side again. So in the medial side, we have the medial crura. We have the medial crura. And in the lateral side, we have the lateral crura. And this midline is the septum. So the septum is formed by the medial crura and the lateral crura forms the external nose. Therefore, the columellar septum is formed by the medial crura of the greater alar cartilage. So if you understood the anatomy of the septum, the next video is going to be about the blood supply of the septum. So stay tuned.